Hello, I'm Sammy Jackson, and today I am going to show you how to teach a patient to collect a midstream urine sample. So the first thing I'm going to do is go ahead and wash my hands, and I'm going to be my own volunteer today for this video. So I will play the role of the medical assistant and the patient. So after washing your hands, you're going to want to gather all of your supplies. So what you're going to need is a pair of gloves, a specimen container with the patient's information on it, and a sanitary cleansing wipe. So the first thing you're going to do is get all this stuff together, and you're going to take your patient back to the bathroom, and in the bathroom there is going to be written instructions on the wall how to perform this task. So you will show that to the patient just for more clarification if they're needing it after you tell them what they're supposed to be doing. So you're going to explain, today we are going to be getting a midstream urine sample from you, and basically after that you're going to have the patient wash their hands. So if I were the patient, I would go ahead and wash my hands. And you're going to want to have them apply the gloves. So you would hand them the gloves and they'll go ahead and put those on. And you always want to identify the patient's last name and date of birth too as well before doing this with them. So once they have that, you're going to give them the sanitary wipe and explain to them how to use it. So for women, you're going to want to wipe front to back, cleaning the whole area. And after you explain that, you're going to explain to them how to do a midstream urine catch. So you're going to give them their container with their information. Basically, you're going to tell them to open up the container, and they are first going to urinate a small amount into the toilet, and after they're going to move the cup underneath so it's in a position to catch their urine. So they're going to go ahead and put the sample into the cup, making sure not to touch the inside of the cup when this is happening, and then after that they can move the cup away and finish urinating fully into the toilet. So once they've done that, you're going to have them put the lid back on, recap it, and secure it, making sure that the lid is on there tightly. And then you're going to inform the patient as well to put the sample back in the designated area for it. So you can put it there. You'll have them remove their gloves and put that in the preferred garbage for that, and then you're going to have them wash their hands again. So after that, the patient is all set to go. As the medical assistant, you are going to put the sample in a biohazard bag and ship that sample off to the lab for test results. And that is how you explain to a patient how to do a midstream urinary